Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, we are from group 1 and now we will discuss about cognitive behavioral therapy or CBT. And this is our topic. First is history of the theory, second is theoretical assumption, third is techniques or skills used in the theory, fourth is application of theory to resolve client's problem, fifth is criticism, sixth is conclusion, and last is we put our references. And first, I will explain about history of cognitive behavioral. The evolution of cognitive behavioral therapy can be traced back to developmental psychology as early as 1913. The work of the behaviorist John B. Watson laid the groundwork for further advances in the field of cognitive behavioral therapy developing over time. Dr. Albert Ellis was a pioneer in behavioral therapy in the 1950s. His work with irrational thinking was the basis in the development of CBT. However, in cognitive behavioral therapy in the early 1960s, it was not until the 1970s that the first cognitive behavioral modification appeared. This intervention period was also one of considerable interest in cognition and in the application of cognitive theory to behavior change. Mahoney has noted that psychology generally underwent a cognitive revolution in the 1960s. The same theoretical focus was brought to clinical psychology only a short time later. As part of the cognitive revolution in clinical psychology, theorists and practitioners are creating models for cognitive and behavioral change, and a veritable armamentarium of clinical engineering. Basically, CBT serves three fundamental proportions. First is cognitive activity influences behavior. Second is cognitive activity can be monitored and changed. And last is change in desired behavior can be made through cognitive change. Two historical standards serve as historical base for the CBT, dominant about behavioral therapy. It is often seen as a major precursor to CBT. To a lesser extent, CBT has also evolved into a psychodynamic model of therapy. It draws on the principle of classical conditioning and operant behaviorism and develops a series of interventions focused on behavior change. However, in the 1690 and in the 1960 and 1970, the shift that began to occur in behavioral therapy allowed the development of cognitive behavioral theory and CBT more broadly was a logical necessity. First, although the behavioral perspective has been the dominant force for some time, it became clear in the late 1960s that non-medicinal approaches were not broad enough to explain all human behavior. And although this approach is met with some limited optimism, criticism from behavioral circles make it clear that such as extension is inconsistent with the behavioral emphasis on overt phenomena. Second, what facilitates the development of the CBT is that the nature of some parts of the problem, such as obsessive thinking, renders non-cognitive intervention irrelevant, where appropriate behavioral therapy is applied to disorders that are primarily limited by their behavioral correlation. This focus on behavioral provide a significant increase in the therapeutic potential during past attempts, but did not fully satisfy the therapists who realized that the entire problem or major component of the problem will not be treated. And last, the field of psychology is changing in general, and cognitivism, or the so-called cognitive revolution, is a major part of the change. Several medicinal concepts are being developed, researched, and established in experimental psychology. All the various attempts to describe self-control in behavioral modification share the idea that the individual has some capacity to monitor his behavior, to set internally generated goals for behavior, and to regulate environmental and personal variables to achieve some form. Regulation in the behavior of interest. To develop this model of self-control, several cognitive processes must be hypothesized, including attempts to define self-control strategies, largely in the terms of components of internal, like cybernetic functioning. Basic behaviorism, the second historical standard that conspired to lead to the cognitive behavioral field, was psychodynamic theory and therapy. And further explanation will be delivered by my friend SAFFA SALSABILA. Thank you.
An important aspect of the early formation of CBT was the development and identification of several theories and therapists who identified themselves with the movement. Some of people who initiated this process were Beck, Sautella, Ellis, Mahoney and Thorsen, and Mason Baum. The establishment of some of the main propositions of cognitive behavior clearly has the effect of creating a psyche that attracts the attention of others in the field. In addition, journaling specifically tailored to the emerging field of cognitive behavior helps advance these trends. This the formation of cognitive therapy and research in 1977, with Michael Mahoney as inaugural editor, provide a forum to stimulate and communicate research and theory on the role of cognitive processes in human adaptation and adjustment. Regular publication in the behavior field allow researchers and therapists to present provocative ideas and research funding to a wide audience. So cognitive behavioral therapy itself is a type of talk therapy that involves identifying and challenging unhelpful thoughts. It works to help people learn alternative thought patterns and behavior that can then improve their feelings. CBT explores the relationship between feelings, thought, and behavior and develops from two different schools of psychology. Cognitive behavioral therapy can be defined as a deliberate combination of demonstrated readiness and methodological rigor of behavior produces where cognitive behavior processes that influence the adjustment of the way to focus on cognitive process that produce feelings. This approach helps by changing people, behavior, and attitudes with a deeper understanding of thoughts, image, belief, and attitudes. This type of therapy is a goal-oriented, short-term form of treatment that can be thought as a combination of behavior therapy and psychotherapy. This treatment takes a practical and practical approach to solving problems. Psychotherapy focuses on the personal meaning of thoughts, patterns that are believed to have developed in childhood. Also, CBT has been shown through various meta-analyses to be an effective treatment for a variety of psychological disorders. It is still highly available to those who would benefit most from its introduction. The next material will be delivered by my friend. Thank you.
Okay, so next we jump into the basic assumptions of cognitive behavioral therapy. The Dobson and Dobson in 2009 say that there are three basic assumptions of CBT. The first one is we can access and know our cognitive process and content. So CBT or cognitive behavioral therapy believe that our cognitive process or thinking process is accessible and we can know it with the help of the appropriate training and practice. We can be more aware of our thinking and how we process it and the way that our cognitive process will result in our feeling and behavior. And in CBT, it will help us to identify the association between our cognitive, feeling, and behavior. And the second one is the way we react to situation is mediated by our cognitive process. So how is it? So let's take a look at this diagram. When we face a certain situation, our automatic thoughts, which is the thoughts that will come into our mind just pop up every time we face a situation, were resulted in our emotional and behavioral reactions. And these automatic thoughts is affected by our assumptions or rules. And in a deeper level of recognitions, it is also affected by our core beliefs. Let's take a look at this example. So, core beliefs are something that is created early in life. For example, from significant early experiences, here, lack of validations of emotions of self in family. So let's say there is a girl that she experiences lack of validation of emotion on and of self in family, and her family emphasizes on achievement and self-reliances. So she experienced in her childhood, for example, that her parents would often accuse her if she cannot have a good grade. And so these experiences will shape her core beliefs, that is, I am not as special as her friends, for example, Ella. I am useless. I am a burden to other people. My feelings are not important. I'm demanding and etc. And this shape that she thinks that she is worthless. I am worthless. I am vulnerable and can cope. And others will criticize or reject or abuse me. And also, beside of the core beliefs, she holds assumptions and rules for living that I must achieve or please others or be perfect or I will be rejected. Or I must keep myself together and avoid losing control or I will be needy and rejected or criticized. This core belief and conditional assumptions or rules for living, and then she faced something that triggers those things to appear. For example, she faced an event that she failed at her university exam, or maybe she is rejected by her crush, Jack, Danny, or Amy. And this event will influence her automatic negative thoughts to pop up. Like, I'm an embarrassment, I'm totally useless, I've never been enough, they're fed up with me, I'll never be loved, and etc. And this creates cognitive patterns, selective information processing with ruminating on failure or rejections. Like, for example, there's no point in going on. Like, she thinks that her life is just useless and self-criticism herself. She started to think that she's weak or useless and she should be able to pull herself together and get on with it and etc. And these cognitive patterns is called cognitive function disrupted by intense emotions. And this is a result of her automatic negative thoughts that are affected by her core belief and conditional assumptions. And these automatic negative thoughts and cognitive patterns then resulted in her emotions reaction and behavioral reactions. Her emotions, she will feel shame, anger, self-loathing. She will feel miserable or even stressed or anxious because of it. And her behavioral response, she will feel like emotional outbursts or intense distress and overdose, chaotic coping attempts, compensatory caregiving, and etc. Also, physiological reactions, like, for example, arousal, poor sleep, appetite, disrupted butterflies in tummy, tearful, and etc. So that is the schema of the second assumption, that our cognitive process affect our emotional and behavioral reactions. Thank you.
So the last assumption is our particular cognitive can be targeted, modified, and altered purposely. As my friend mentioned, our thought, feeling, and behavior are connected. Thought can create a feeling which then influence in our behavior. So in a CBT, patient will work together with the therapist to develop skill for testing and modifying belief, identifying disorder thinking, changing behavior, and push them to adapt their thinking in a more positive way. Sometimes when we throw the negative events, unconsciously we create an irrational belief, and Albert Ellis believed that people often forcefully hold on to this illogical way of thinking, and then therefore employs highly emotive technique to help them forcefully change this irrational thinking. And this technique called the ABC model. So there are 3 steps in ABC model. The first step is activative event or objective situation. The second is belief, and the last is consequence. In the first step, or in activative event, the therapist will ask the client what is event that leads them to some type of high emotional response or negative dysfunctional thinking. It could be fell to the job, broken heart, or fell to the test, or something that labeled as negative event. And in second step, or in belief, the client have to write down what is negative thought that's coming to their mind in that situation, such as she might thought that she is worthless, poor neighbor, or something like that. And in last steps, or in consequence, the therapist will ask the client to describe emotion or negative thought that client thinks are caused by the activative event. This could be anger, sorrow, or anxiety, or etc. So after the client feel that 3 steps, we will know what is the negative event that she has, what is the irrational belief that she has, and what the negative emotional that she produced because of that event. So after irrational belief have been identified, we can reframing that belief, which means we can reinterpret the belief to more realistic way. So we help the client to develop more rational belief and healthy coping strategies. So when the client plays the negative event that that same as the previous, because she has built the rational belief, she will know what is how to coping that event. So maybe she fight to the job and she think, oh, I'm not good enough. Why I can do that job properly? I'm worthless. I'm something like that. We can change their thoughts, like fight from the job, maybe disappointing, but that's not awful. You can do better in your next job. You can do or maybe this job is not suitable for you. You can do more better or harder in next job. So when she fight to the next job, they will feel sad or frustrated but not depressed. That sadness and frustration are likely have negative emotion and may let the client to working harder from then on.
So this is one of the technique that can modify our thinking or our thought.
So I will continue the presentations. For the next, there is techniques or skills used in the theory. There are various techniques for changing cognition, emotion, and behavior that are the most important part of the CBT theory. This method develops according to the needs of the client, where the therapist is active, directive, time-limited, structured, and centered on the client. Therapists, also known as cognitive behavioral therapists, usually use a variety of intervention techniques to reach agreement on the target behavior with the client. Cognitive behavioral therapy is commonly used to treat mental health problems such as anxiety and depression. However, not only that, cognitive behavioral therapy can also be used to help us deal with everyday problems. There are several techniques that can be used during therapy in everyday life, such as, first, there is journaling. This technique is a way to collect about a person's moods and thoughts. In this technique, we will usually be asked to make a list of negative and positive thoughts that arise between sessions during therapy and also record mood or thought, especially noting the time, level of mood or thoughts, and what caused it. Writing them down can help us see how far we have come. For the second, there is nightmare exposure and scripting. This technique is almost the same as interrogative exposure, which means where nightmares are generated which elicit relevant emotions. The client and therapist will work together after the emotion has arisen to identify the desired emotion and develop a new image to accompany the desired emotions. Next. For the next, there is relaxed breathing. There are many ways to relax and get your breath in check, such as flash and unfocused image, YouTube videos, audio recordings, script, and the like. Bringing calm and order to our breath will make it possible to approach our problems from a balanced place, as well as facilitate more rational and effective decision. This technique can be practiced with or without guidance from a therapist. This technique can also help someone who suffers from various mental illness and afflictions, such as depression, anxiety, OCD, and panic disorder. For the next, there is play the script until the end. This technique is very useful for someone who often suffers from fear and anxiety. In this technique, a person who is prone to fear and anxiety will be asked to conduct a kind of experiment wherein imagine what would happen in the worst case scenario did happen. If following this scenario to continue can help one recognize that even if all that was fear would happen, the outcome would still be manageable. So that's all from me. The next slide will be explained by my friends. Thank you.
Alright, my name is Tiara. You can call me Tiara or Rara, and I will continue about what Jinan explained before. So this is unraveling cognitive distortion. This is one of CBT main objective, and it can be carried out with or without a therapist assistant. You must first become aware of the cognitive distortion you frequently experience in order to untoggle them. This requires, among other things, recognizing and resisting dangerous automatic thoughts, many of which fall into one of 15 categories mentioned before previously. And next is progressive muscle relaxation. This is mindfulness practitioners will be familiar with this technique. This technique, like the body scan, instructs you to relax one muscular group at a time until your entire body is relaxed. You can practice this technique with audio guidance. a YouTube video, or simply your own mind, and it can be especially helpful for calming nerves and soothing a busy, unfocused mind. Next is cognitive restructuring. Once you identify your own distortion, you can look into how they came to be and why you believe them. When you discover a destructive or harmful belief, you can begin to challenge it. For example, like if you believe that in order to be a respectable person, you must have a high-paying job, but you are then laid off from your high-paying job, you will begin to feel bad about yourself. Instead of accepting this faulty belief that cause you have negative talk about yourself, you could use this time to consider what truly makes a person respectable, a belief you may not have explicitly considered before. Next is introspective exposure. Is used to treat panic attack and anxiety. It entails exposing yourself to feared bodily. To feared bodily sensation in order to elicit a response. These activities, any unhelpful belief associated with the sensation, allow the sensation to be maintained without distraction or avoidance, and allow for new learning about the sensation to occur. It is intended to help the sufferer see that panic symptoms, while unpleasant, are not dangerous. And the last is exposure and response prevention. This technique is especially beneficial for people who have obsessive compulsive disorder, or we call it OCD. You can practice this technique by exposing yourself to whatever normally elicits a compulsive behavior while attempting to refrain from engaging in the behavior. You can use the technique in conjunction with journaling, or you can use journaling to understand how this technique affects you. Right, that's all from me.
Alright everyone, we're moving on to the next explanation, which are application of theory to resolve client's problem. So, cognitive behavioral therapy, or CBT, was first published in 1977. According to Butler et al. In 2005, there are more than 500 outcome studies that have shown that CBT is effective for treating a variety of psychiatric diseases, psychological issues, and medical conditions with psychological components. In this video, I'd like to show you 3 examples of the application of CBT theory, which are applying CBT for anxiety disorder, and then depression and substance use disorder. Let's start with anxiety disorder. So the most commonly used CBT treatment methods for patients with anxiety disorder are exposure therapy and cognitive therapy. In exposure therapy, this method is the first line of treatment for many anxiety disorder. This method is finished in about 10 sessions. And then how this method works? So pathological fear can be changed through exposure by first activating it, and then replacing it with the new information that disproves the association. And then there are 3 types of exposure. There are imaginal exposure, in vivo exposure, and interoceptive exposure. Okay, and then the next method is cognitive therapy. So cognitive therapy based on Back-3-part emotion model, which are thoughts, feeling, and emotion that are interconnected. The importance of this method is alter the patient's maladaptive thoughts before altering their maladaptive affect and behavior. This method typically time to no more than 20 sessions. All right, these are the example of the use technique of cognitive therapy. Number 1, identifying incorrect thinking. Number 2, examining evidence that refutes automatic thinking. 3, challenging and altering maladaptive thinking. 4, altering problematic behaviors. And last is relating to others in more adaptive ways. So typically, patients are given homework to help them practice the skills in their daily lives and become proficient with the procedures so they can use what they have learned after treatment is over, such as different forms of disordered thinking. For example, like jumping to the conclusion, disqualifying the positive, and so on.
Now I will convey the second and the third point of applying theory to solve client problems. So, the second point is applying CBT for depression. Depression is one of the most common psychiatric illnesses affecting people of all age, especially in teenagers to early adulthood, and women suffer twice as much as men. It typically manifests as a conciliation of symptoms that include cognitive, emotional, behavioral, interpersonal, psychological, social, and vocational. The victim of this depressive disease may experience significant symptoms that disrupt their social life. CBT for depression usually starts with education about the depression and helping the client understand their symptoms as part of an illness they can do something about. The client and therapist will together collaborate to confront the client's unpleasant beliefs about themselves, the world, and their future, which may add to the feelings of their pessimism. The treatment strategies include helping clients to establish structure around daily activities, become more aware of their moods and also change their negative thoughts, and engage in pleasurable activities. Next is some of the benefits of CBT to treat clients who are depression include the first is reducing symptoms of depression as an independent treatment, or also maybe it can combination with the drugs. And the second is changing underlying schemas or beliefs that support their depression. The third is treating different psychosocial issues that cause depression, such as arguments with others or stressful jobs. The fourth is CBT can also reduce the likelihood of recurrence. And the last is increase the adherence to medical care that has been recommended and carried out. Then we continue to the third point. The third point is applying CBT for substance use disorder. The idea behind cognitive behavioral treatments for drug use or substance use disorders holds that learning mechanisms like reinforcement and conditioning are crucial in the growth of addictive behavior. The therapist and also the clients will propose the issues and create efficient coping mechanisms. People learn how to recognize and change their self-deviating behavior by using a variety of techniques that can be used to reduce or stop using the drugs or the substance use. CBT can help clients to overcome their addiction to drugs and alcoholism by slowly and surely eliminating false beliefs and insecurities that lead to the drug or substance use. CBT will help themselves to improve their moods and thoughts. If it can be controlled, it can be reduce their thought to consume the substance use. And then the last is teaching effective communication skill with the surrounding environment. It can also minimize the client's habit and get rid of their habit of substance use. Cognitive behavioral therapy techniques can be practiced outside the therapist's office. Those in recovery can do many CBT exercises on their own from home, or maybe they can also do it in a group settings. Addiction support groups like the self-management and recovery training or we can call it SMART program, also incorporate CBT principle into their self-help exercises to encourage continuous sobriety. This program has the goal of changing the people's behavior, ideas, and also about their feelings. Similar CBT treatments have also been created, which may incorporate a wider variety of psychoeducation, cognitive reappraisal, skills training, and other behavioral strategies in addition to paying attention to the function cues for drug use or the substance use.
I'm FANIAR, and I'm going to explain about the strengths and limitations of cognitive behavioral therapy or CBT. So some of us may have known that cognitive behavioral therapy or CBT is an effective form of therapy. Over the last 30 years, CBT has made massive contributions to mental health care. For instance, for particular specific disorder such as panic and OCD. Aaron Beck also stated that CBT is very effective for treating anxiety and depressions. Okay, the next one is the skills learned in CBT prepare client for real-life situations. So, for example, homework techniques. Let's say there is a client who's suffering from social anxiety disorder, and therapists might invite a client to initiative to make conversations in a day with one person and write it down on a worksheet about how they feel by these actions. So it provides the possibility of success experience for the client. The next one is clients can act as their own therapists. So one of the main areas of cognitive behavioral therapy is constructions of formulations, which open up a space within the therapy where the client can begin to learn CBT concept itself. And the aim or the purpose of constructions of formulations is for the client to become their own therapist, which will make them be able to deal with the future occurrence of the problems by initiating CBT strategies on their own. And the next one is CBT give clients opportunities to practice new skills and ways of coping. Unlike most other therapies or theories, CBT doesn't merely involve talking about the difficulties, but CBT can also encompass enacting sequences of behavior, which give clients opportunities to practice new skills and ways of coping, rather than avoiding the problems itself. The next one is CBT encourage clients to face their fear directly. Where many other therapists or theorists talking about or encourage clients to try to understand the nature of the fear itself, here CBT encourage clients to face the fear directly. In this case, a person purposefully engage with fearful situations in a context in which they feel supported by therapists. So they will either realize that their fears are illusory, or we call it illusi, such as nothing bad happened when I put spider in my hand, or they will possess coping skills that allow them to tolerate the situations. For example, I'm being terrified on aircraft, but I know that if I'm practicing my breathing, my relaxation techniques, and positive talks, I will survive. Yeah, something like that. So this idea comes from conditioning theory, which predicts that if a person continues to be exposed to situations or stimuli in the absence of frightening consequences, the fear that has become conditional response to that stimuli will gradually fade. Yeah. And the next one is relapse preventions. You know that while many clients who are helped with the therapy to change their behavior may initially make good progress, but at some point they encounter some kind of crisis or problems. So this is called relapse. So CBT provide client with relapse preventions with strategies and skills they provide in CBT. The client can learn to identify the situations that are likely to evoke a lapse or require social skills in order to deal with them. Okay, so we'll move on to the limitations of cognitive behavioral therapy. So the first one is there is a possibility that CBT might make clients feel worse before it makes them feel better. So, clients must be willing to show their weaknesses, to deal with tough emotions, to address difficult thoughts and feelings in CBT. So, in the initial sessions, clients may experience anxiety and discomfort when discussing their problems to the therapist. Although it is acceptable to experience these feelings, it is possible that CBT will worsen clients' feeling before improving them. And therefore, the effects of CBT might not become apparent after the first few sessions. And most typically, people find it easier to stop it before they begin to feel uneasy and vulnerable feelings. So the second one is, it is not clear whether faulty cognitions are a cause of psychopathology or a sequence of it. So yeah, it is still unclear exactly what functions cognitive process serve. It is unclear whether flawed cognitions are a contributing factor to the psychopathology or result of it. So in a group of participants, before any of them experienced depressions, Levinson in 1981 found that those who later experienced depressions were no more likely to experience negative thoughts than those who didn't. So this suggests that despair and pessimistic thinking may accompany depression rather than be its root. So the next one is, the success of the therapy depends on the client's willpower. Yeah. CBT is a collaborative therapy in which each client must be committed to the therapy for it to be effective. So when clients are not collaborative within the therapy, so there is a little possibility to the therapy to be success. So the last limitations is CBT only focus on current problems and specific issues. Yeah, as we know that CBT is therapy that based on now and here rather than past experience like psychodynamic therapy. So the therapy itself seeks to disrupt the destructive thought cycle and replace it with constructive one. But however, unfortunately, the causes of the problems are not addressed by CBT. That's why this is the limitations of the cognitive behavioral therapy. So that's all for me. Thank you.
Hello everyone. Now we come to the conclusion of our presentations today. So the cognitive behavioral therapy, aka CBT, is used to treat a wide range of psychiatric issues. Depending on the problem, the treatment lasts between 3 and 6 months. CBT divides the problem into smaller pieces, so each pieces receives a separate attention. This technique also helps the patients change negative and automatic thoughts into more beneficial ones. The overall goals is to teach the ability to break down a negative thought patterns and replace them with more helpful approach to dealing with everyday life. A principle in this CBT is the patient's active participation in this therapy. So the goal-oriented and problem-focused approach will be ineffective without it. And CBT sessions are well structured, and the clients improve of understanding of the role of the cognitions in the correction of behavioral dysfunction is critical to their success. This educative approach promotes the development of the client-therapist relationship, which is an important principle of this therapy. Cognitive behavioral therapy is a time-limited method, and success requires work outside of the therapy office. This approach is initially focused on the presence. A focus on adaptive thinking allows to relapse the preventions. It enables the patient to be taught techniques to change their thinking mode behavior, and with the expectations that they will use them in the future. So the cognitive distortions are thought to cause psychological problems in a cognitive behavioral therapy. According to Aaron Beck research, correcting these distortions results in more accurate experience events. A patient is better able to develop skills to properly process exposure to life events as a result of this work. So Dr. Beck considered a close personal relationship person to person with the patient to be essential to allow for the explorations of automatic negative thoughts. A trusting relationship was required. Some of these patients were disturbed by his more admissions of this thought. And then, working with Dr. Beck to reframe these talks resulted in significant self-reports to make an improvement for a large number of patients. So that's the conclusion of this cognitive behavioral therapy. I hope you guys and Madam understood what that my friends presents. So this was the reference that we writing about these tags. Thank you and see you guys. Wassalamualaikum warahmatullahi wabarakatuh.